Welcome, and thank you for joining us for another edition of the Leadership Café, where we talk to extraordinary people leading remarkable businesses. We're your hosts. I'm Michael Couch.
And I'm Richard Citron, and we're so glad that you've joined us today. Before we get too far along, we want to make sure and thank our sponsor, Vaco, Global Talent Solutions Company. We're grateful for their support of the Leadership Cafe. And today I'm really excited. I've got our special guest is a longtime friend. He is the Senior Vice President and Chief Information Officer at the University of Pittsburgh Medical Center, Ed McCallister. Ed, thank you so much for joining us today.
It's great to be here. Thank you, Richard.
Yeah. So Ed, I've known you a long time, and I know so much about your leadership journey. I've followed your career. Tell us a little bit about your work, your leadership journey. What's been your path to leadership?
Sure. So again, leadership is that, the leadership journey is kind of like if you've seen one, you've seen one. I think so. I'll try to share. Where it started without being too long, because I don't want to get too wordy on it. But it was an interesting start. I'm a Pittsburgh guy, and I graduated college in the early '80s, early to mid. And anybody that remembers the job market at the time, it was dismal. The steel mills were closing. It was not a good environment, and so I had to relocate it. Along my journey to find a job, a friend of mine was in Texas working for EDS, Electronic Data Systems, and at the time they were owned and led by Ross Perot.
Yeah.
Right. So I took the job, relocated from Pittsburgh to Plano, Texas, and our responsibility was to move from Dallas to Plano, move the corporate headquarters. So we worked 10 at night till 10 in the morning, 10 in the morning till 10 at night. We were building the data center, installing the hardware, doing whatever it took to move the data center. So probably 2:30 in the morning one evening, it's dark and it's in the middle of a field in Plano, Texas, which, by the way, Plano is a bustling place now, but at the time, tumbleweed was about the only movement that you saw besides us. And there was a bright light outside the window, right? And I'm thinking right away UFO, and we sit back and I'm with a couple of colleagues and we're having our peanut butter sandwiches, because that's about what we could afford at the time with that entry-level job at EDS. So you notice it lands, it's a helicopter. So about 5 minutes later, this little guy comes walking through the door. He has a little brown bag and how y'all doing? And he sat down with us, and it was Ross Perot. And he actually came in, asked, what issues we were having, thanked us so much for what we were doing. You're talking about some entry-level folks into the IT world. And for him to do that, I think it stuck with me forever, because it was a leadership trait that I think I've never forgotten, and that you have to be genuine. You have to be truly caring about what's going on. He didn't just show up with an entourage and say, like, I'm here. He sat down with us, had his ham sandwich, and just discussed with us for probably about an hour, and jumped back in his helicopter. And a classic line that I'll never forget, a good friend of mine at the time, we were sitting together, and he looked over at me and he said, he's a guy just like us, except he has a helicopter. So that always stuck with me. So I was with EDS for the first 3 years of my career, and like most Pittsburghers, I boomeranged back to Pittsburgh, and I landed a job after 3 years at EDS with a large insurer here in the region, which was Blue Cross at the time, later became Highmark. And I spent 11 years in different roles, at Highmark, got into management roles. And again, in late 90s, I guess 1999-ish, 1998, 99, I came over when UPMC was starting a health plan. So it was great. It was a great startup environment for an IT guy, because I came in and there was no technology. So you had a whiteboard of how you wanted to create and the budget to do it. So it worked out well. I think I was employee number 58. Richard and I were talking. I think he came on about 5-6 years later. But in the early days, it truly was a startup. You forget about that now, because so fast forward 22 years later, we went from a revenue of, you can count in the hundreds, to where we're at about $11-12 billion in revenue. We have 3.9 million members within our insurance services division. So it truly was a success, one of the most successful startups you'll hear. And obviously, the backing of UPMC and the vision of UPMC to make it happen is why the success took place. So that's kind of how I landed where I am today, again, with cutting out some of the the smaller pieces in between. But
Yeah.
I think along that journey, and Michael, your point, I think you recognize traits of people, both good and bad, that you want to make sure that you continue on when you're starting your career.
Mhm.
Yeah. Well, I love that story about Ross Perot. I'm going to steal
Yeah.
that.
Yeah,
Maybe it was an alien. You don't know, but
it could have been.
but your story, like you say, it's one of one. But we do see some themes that, and when we've talked to the 40-some successful executives, is that it wasn't a class I took one day. It was navigating a significant challenge, starting something from scratch, building something new. And then there's people. There's somebody in throughout your career that really made a difference for you, and that's the pattern we see. So it's great to hear those additional unique stories, but
Yes.
that's where the skills come from. Phenomenal.
Sure.
So, being at UPMC and being in a healthcare environment, I imagine 2020 was and remains all about COVID. What's the role of the IT group in that, in terms of support or leadership, in terms of what those first responders and healthcare workers are needing right now? What are you seeing in that regard?
Yeah, so that's a great question, Richard, because it seems like it's been with us forever, the pandemic, right?
Yeah.
But if you rewind, it was March 13th, a Friday the 13th, when we were all sent home, right? And we were asked to continue to do our jobs, but we had to stay home. So UPMC has never been shy about investing in technology. And fortunately, in this case, it happened. So we moved Office 365, one of the first healthcare organizations to move to Office 365, and definitely the largest, 6 months prior to the pandemic. So we had already stood up like some of the Teams opportunities, Yammer, some of the abilities to communicate. And the reason that we invested was because UPMC, we've grown from 20 hospitals 7 years ago to where we're close to 40 hospitals now. So our footprint has expanded, and the way that we would come together physically in the past just couldn't happen anymore. So we were planning on remote activities and interactions prior to the pandemic. So on that day, we were able to stand up within a week, 34,000 of our employees that were critical in a remote location. Today, we have 78,000 plus remote workers within UPMC. And again, the reason is because not only the Office 365 investment, but the investment in our core network. It's a commercial grade network. So we didn't have the degradation that I heard a lot about in the early days of when we went live. So in our employee base, it's really interesting because the passion that we have, like working for a healthcare organization. And if you think about my career, except for the first 3 years at EDS, it's been spent entirely in healthcare. And I've heard some of your folks in the past have mentioned, the importance of healthcare. I think that the technology piece is one component, but technology without passionate people and passionate customers is useless. It's not very interesting. So our doctors, our nurses, our frontline staff, our operations folks, they go shoulder to shoulder with us as to what we need, what investments we should be making, and how it should work. So it's been a true team effort when it comes to technology deployment and what we've done to stand up the technology needed during these very trying times.
Was that somewhat of a surprise that you were able to do that rollout in a week? Or was there things that you and your team had done in years prior that sort of prepared you for some agility like that?
Well, because UPMC has grown through acquisition, grown through organic growth, so we've always been in growth mode. And I mentioned the numbers around the health plan. So when you're in growth mode, you're investing in technologies that are going to eliminate some of the issues that you have, again, around system degradation. How can we scale? So I don't know that we weren't surprised. I think that, again, the team that I lead, I'm never surprised. I mean, the passion and commitment that they have, just from the beginning to what we're doing around vaccines today is phenomenal. So I wouldn't call it surprised. It was absolutely fortunate that we were able to, and I don't take it for granted. Our leadership at UPMC, all the way to the CEO, has always committed to technology and understood the importance of technology, because the patient is at the center of all we do, and surrounding that patient is all the enablement, whether it's through technology, our nurses, our clinicians, they all pull together knowing that the patient is at the center of everything we do.
Phenomenal.
thinking about the remote teams, what's the role of leadership with remote teams? Is that something that you within the IT group get into? So you've set up this infrastructure for remote teams, and you've got 35,000 remote workers. What do you say to leaders in terms of how to manage them, how to support them, how to help them to be efficient and productive? Are there some tips about that you have for some of our listeners?
Yeah, that's a great question. So it's 78,000 people. That
78,000, sorry.
Yeah.
The initial was 34,000, but yeah. So we have some tools that we're able to, in an agnostic way, understand like how can we better manage different teams. And some people, and don't get me wrong, we're not an industry that has the luxury of saying, or go home and everybody work from home. No. We've had people that haven't left the office since the pandemic started, I can tell you. And again, you hear a lot about the frontline workers. It goes a few layers deep. You'll see the folks at the bedside, but supporting the folks at the bedside are tons of nurses and operations folks and PC support and IT people. I'll give you an example. Our telemedicine efforts, right? And you hear a lot of numbers around telemedicine, but ours it's truly a great story. I think the technology was there to do telemedicine, but it just wasn't a widely adopted means of care. People like that in person, the touchy-feely care, and there's still a lot of that needs to happen. But we recognize that there are areas where telemedicine is as effective, if not more effective, in a means of caring for somebody. It eliminates the need to drive into Oakland and find a parking spot and do everything we've done. So we've leveled off at about 6,500 telemedicine visits per day.
Wow.
And just to give you an idea what that is, we were doing about 250 in February of 2020.
Wow.
And now we're up to 6,500. And that's not at its peak. In March and April, when we needed to reach out and actually care for people, care for our patients, it was at a higher level. So it's going to level off. I don't think we won't stay at where we are, but it will absolutely be here to stay. Much like a remote workforce, telemedicine, the genie's out of the bottle, and it's not going back.
And I do my telemedicine sessions right on my phone here with my docs, and it not only is it convenient, but it's so efficient. And I've even had docs who have said to me, I want you to get up and do something. I had a concussion last year from a car accident, and so Mickey Collins, who is the concussion specialist at UPMC, said he had me doing some exercises that he was able to watch me and make some diagnostic impressions based on his observations. So truly amazing, and I think that's a great indicator of the adaptation that you saw by the physicians, and I'm sure other healthcare workers as well.
Yeah. Absolutely. That's a great example.
Yeah, and I think the other example, I'm a patient as well and found it exciting, but then very effective. But then my 92-year-old parents, how helpful it is for them to be able to have that pretty almost instant access during a tough time, and they learned and were comfortable with the technology. So that shows we can learn forever, I think.
And that's well stated. We absolutely could, and let's face it, we're in Pittsburgh. So the weather is not always accommodating when we have a doctor's appointment, right? So there's a lot of factors that play into it, but I do think it's a very effective tool that we have, knowing that it's not a total replacement. Much like a remote workforce, there are always going to be people on site. We're leaning toward more of a hoteling arrangement, so that if you do need to be on site, we bring you back safely and in a way that makes sense. But I see telemedicine the same way. There's a definite place for it, and it's not going to go away.
Does that also mean significant changes in facilities for UPMC as we're rethinking how care is going to be delivered?
I do. I think it absolutely. The pandemic, obviously has created many challenges within our hospitals and within the ICUs, and I do think UPMC's done better than most. This is a personal observation, but if you turn on any of the evening news channels, you see a lot about what's happening in California, and you see what's happening in New York and different areas, and it's enough to throw you off center. And being in healthcare, I probably understand more than most. Not as much as our brilliant clinicians and physicians are here, but more than the average person. And I recognize we have daily huddles and weekly calls, so wide open communications across UPMC to say, like, hey, here's what we're seeing. We've had Dr. Don Ely and Graham and Tammy Minier, and they kind of lead the discussion. and it's a group that we're so confident in.
Yeah.
Whether it's Dr. Snyder leading the call, or Tammy or Dr. Gilly, you feel like you're getting the information that you need now, and that you share with your parents, and that you share with your families and friends. That, like, here's what it really is. It really isn't good, but please don't panic about what you see, what's happening in California. I think UPMC at one time, you may have seen the article, we were doing 1 in 5 vaccinations here in the state of Pennsylvania, where they said we probably, if you look at the optics around the dynamics, we should have been doing about 1 in 30, but we were doing 1 in 5. So I think it's a result of, again, our great clinical leaders, our operations folks having the ability to organize and do what we need to do to help try to control this pandemic.
And I know you've been involved with the Pittsburgh Technology Council. Can you speak a little bit about leadership in terms of, Pittsburgh is seen as such a technology hub, and what is it about Pittsburgh, and what are some of the important leadership issues that the community faces in terms of technology advancement?
Richard, I've seen, living through the kind of .com era and seeing what's happened, Silicon Valley and all the excitement around it. I think what differentiates Pittsburgh and why people are, they matriculate to Pittsburgh, there are a lot of reasons, and I won't get into like the political reasons or the tax implications, but I think the people of Pittsburgh and the corporations that have relocated to Pittsburgh, they have that quality that I described earlier with Ross Perot. I think that there's a feeling of hometown. It's not a hustling, bustling city necessarily, but we transitioned. I saw the amazing transformation from a steel town. I grew up in Homestead, 2 blocks from the steel mills, right? And I've seen it from the steel mills to Eds and Meds. So I think that's what's driven a lot of the technology interest in the matriculation to Pittsburgh, is the fact that we have such great universities, University of Pittsburgh, Carnegie Mellon, and Duquesne University. The universities are, at front and center, but there are many others. Yes. And I think and then UPMC and the clinical footprint that we have here in this region, and healthcare being kind of at the forefront, even before the pandemic, of what we're driving, both of importance and economically, I think is the reason why you see a growth in the startups and in the different technology companies in Pittsburgh.
Mm-hmm. Yeah, it's very exciting. I came here in 1980. And didn't think I was going to stay around an area that was struggling so much at the time.
Right.
You'd have to pry me out of here now. I mean, it's just there's so many exciting things, and the arts, even through the pandemic, have struggled, but have been some amazing and passionate creative work that's going on in conjunction with the technology. It's very, for me, it's very enlightening. And then talking with the 40 or so leaders from this region has been very enlightening and enervating too. So we really thank you for those observations.
Sure.
One of the questions that we've been finishing up with folks in relationship to to what we've all been through in the past year, and of course, assuming hopefully that you haven't had any losses of loved ones or anyone who was particularly ill, but most people have thought about 2020 in terms of what the pandemic has done to them. We've been asking folks about what the pandemic in 2020 has done for you. Have there been any gifts or understandings or enlightenments that you've gained this year that you think you'll carry forward to 2021 and beyond?
And that's a great place to end, because I think that when we hit the end of 2020, everybody took a deep breath and said, that's great. I think 2021 is going to come with its own challenges, but what 2021 brings is the lessons learned from 2020. Yes. And we didn't have that heading into 2020 necessarily, right? So I think that the preparedness that people have, and I think that the recognition that you can do things remotely and through technology and keep your employees safe, because that's our main goal, is to make sure our employees are safe, that our patients are cared for in an extremely safe environment. And I don't know how much time we have, but I want to just share with you, 2020 was challenging for me, both personally and professionally. We talked about the professional side. So my father was diagnosed with a brain tumor end of 99 or 2019. And so he did surgery. So through 2020, he went through the treatment process over at the Hillman Center. And I could tell you that I took my CIO hat off and my UPMC hat, and I became a son to a father that was going through some things that were just amazing. And I can tell you guys that I was so humbled that I worked for this company because of the people that cared for my father. I just sat and watched in amazement at times as people came in their most vulnerable states and in, very sad times, and just the work that the nurses did, around it, and the caregivers were just amazing. So I kind of have such a greater appreciation heading out of 2020 into 2021. And I'll tell you the truth, I have more passion about my job than I've ever had, and it's always been there. And I think it's just created, such a feeling of pride to work for a company that cares for people in their most vulnerable times. And by the way, I speak for myself personally. I look around the room, I look around the company, and it's there. I mean, everybody has it.
Right.
You could work for Google, or they're doing great things, right? If you can create the next generation search engine or do some of the things they're doing, they try to dabble into the healthcare space, but true healthcare happens where I am. And I can tell you, it's a special person that works at UPMC within the IT organization, within the nursing organization, our physicians, our operations folks. They're amazing people. They really are. And it's just such a privilege and a special feeling to work here amongst such great individuals and coworkers.
Well, your pride comes through, and from all of us who have had care at UPMC, we certainly know what you're describing. That is certainly the case as well. And I hope your dad is doing okay.
He passed away, so that was very awkward. I apologize, but he passed away. But I can tell you that he passed away in a very dignified fashion, and it wasn't for lack of care.
Right.
He outlived the diagnosis. So I apologize for.
Yeah, no, thank you for sharing that. That was.
But I wanted to just say the care that he received over the 14 months that he was struggling with his recovery was phenomenal.
Yeah.
Well, this May I'll be a 5-year cancer survivor. So, and I thank my docs and the folks at UPMC every year, on that anniversary. So I applaud and support the kind of work and the great people at the UPMC.
Yeah, thank you.
Well, Ed, we want to thank you for joining us today. Your history, your current story, your personal sharing. That's I know that's who you are, and that authenticity is what sets you apart from other leaders. And that's one of your great qualities, I think, as a leader is you're the real thing. So, thanks for joining us today. We appreciate it.
Thanks for having me.
If people want to reach out and connect with you, probably LinkedIn would be a good place to go.
Absolutely, yes.
And if anybody wants to work for you after doing this, where's they go to UPMC Human Resources, or is there a good place for them to?
UPMC.com, and it would direct you to positions, opportunities within UPMC. Yep.
And we're going to send you a signed copy of our book, Strategy Driven Leadership. I know you already have a copy, but we'll give you one for your.
I keep it handy by my nightstand in the evening.
Well, I know what that's about.
It's next to Bill Campbell's book, which, by the way, if you talk about leadership, The $1 Trillion Coach was a book that Bill Campbell, who was a Homestead native, went out and he was Steve Jobs. They called him the Silicon Valley Whisperer, but he was a local professional that did well. And if you want a reading, I'll send you an autographed copy. It would be forged, but
I'll take it. Bill Campbell, I'll make a note of that and get it on my reading list.
Absolutely.
Hey, we also want to thank our sponsor, Vaco, for helping make the Leadership Cafe a place where we meet amazing people like Ed McCallister. This podcast will be released soon. It'll be on Michael and my websites as well as Vaco. It'll be also on Spotify and all of your favorite podcast places to go. We want to thank our producer, director extraordinaire, Michelle Jarizowski, for her amazing and great work in producing and directing the Leadership Cafe. We want to thank you for joining in, and I'm Richard Citron.
And I'm Michael Couch, and we look forward to connecting with you on the next Leadership Cafe.
Thanks, guys.
Thank you, Ed.